Hello all, and thanks for joining. This is Mike Avello with the Government Affairs Department at the Medical Society, here to give you a brief overview of the 2019-2020 proposed executive budget. We've been pouring through the myriad policies and pages of the budget, and overall we think it's a fairly innocuous budget. There are definitely items in there that we oppose and that we're fighting against, but there's definitely some good items in there. As always, the devil's in the details, and there's plenty of time for amendments. But here are some of the items that we have highlighted for you. First, there are a few items in there that would help to improve public health. The first of which would create a statewide maternal mortality board. This, as it stands, New York is currently 30th out of 50 states in maternal death rate. We strongly support the provision that would allow for the creation of this board. It would help to accrue data and then use that data to improve, the care of mothers in the state. Most importantly, this board would include vital confidentiality protections. The second item is the raising the age for tobacco and e-cigarettes from 18 to 21. Also banning the sale of flavored liquids and the sale of tobacco and e-cigs in pharmacies. MSSNY has a strong standing support of this. As you know, a report by the Institute of Medicine has concluded that raising the purchase price to 21 would have a substantial positive impact on public health. It would significantly reduce the number of adolescents and young adults who start smoking, and also reduce smoking-caused deaths. As it stands, 23 counties across the state have already raised the age. This measure would expand that statewide. MSSNY also supports efforts to reduce the instances of prediabetes and diabetes. Almost 50% of New York's population is diabetic or pre-diabetic, and the budget proposes that Medicaid be required to cover services under the National Diabetes Prevention Program. This program is a CDC-recognized program that contains ways to fight diabetes and prevent the progression from prediabetes to diabetes. Finally, the regulation of pharmaceutical benefit managers. As it stands in New York, PBMs are basically unregulated. This provision would make statutory changes necessary to regulate the registration and licensure of PBMs. We really support giving the Department of Financial Services the tools that they need to, bring about greater transparency, hopefully reduce costs in the pharmaceutical industry. As we've seen with the CVS-Aetna merger, we always have to be wary and vigilant when it comes to PBMs. The budget also contains provisions to reduce costs and to hopefully improve the liability environment, the first of which is the extension of the excess medical malpractice program. This would extend the program for another year at the same level. Unlike in past years where contingencies, strings were tied to the program, none of those would exist this year. Additionally, the policy in the budget would reduce the interest rate on judgments or accrued claims. Now, as it stands, they're paid out at a flat 9% interest rate. Now, this would change to tie it to the current market rate of a one-year Treasury bond. Just checked, and at the end of January, this rate was at 2.55%. So we think this could have a significant decrease on your liability insurance premiums. There are also measures in there to fight opioid addiction and mental illness. The first of which is the prohibition of pre-auths on medication-assisted treatment. Now, we know pre-auths are a burden and a hassle across the board, especially so for treatment of those fighting opioid addiction. Don't want to expose your care to bureaucratic decision-making, and preventing pre-auths for medication-assisted treatment, we think, will go a long way to helping you treat your patients in a timely manner. Furthermore, the budget contains policies to ensure comprehensive health insurance coverage for those suffering from mental health conditions. So this would remove some items like benefit limitations, multiple co-payments per day. It would put co-payments for mental health treatment on par with medical treatment. It would also prohibit denials of medical necessary care. Furthermore, it would really help to ensure that network information is transparent. It would require insurance to post additional information regarding their behavioral health provider networks, and also they would need to provide their most recent comparative analysis for insureds. We think that this will go a long way towards codifying parity standards and would help to ensure that behavioral health issues are treated on par with medical health issues. It can't all be good. There are certainly some items in there that we oppose. The first of which being legalizing the sale of adult use recreational marijuana. We do have concerns such as how will we protect motorists and others from those driving under the influence. We also believe that marijuana use could definitely increase the likelihood of addiction to other drugs. We've long voiced these concerns, and we do believe that if legalization was to occur, it should be restricted to those 25 years and older. And also, the state is projecting pretty significant financial windfall in terms of tax revenues. If that is to occur, we really strongly support that a large portion of that be provided for public health education and support programs. Furthermore, we also don't think that something like this should be passed in the budget. It should really be open to significant dialogue, open discussion with all stakeholders at the table. The budget also repeals prescriber prevails. We know this happens almost every year. The budget, it works to revoke it, and then eventually the legislature puts it back in, but we definitely can't rest on our laurels. This provision would repeal the physician's final say and would instead consider the physician's information, but at the end of the day, it would not be the physician's final say. We definitely want to fight for that. We don't want, bureaucrats to be making the decisions, as we said. One of the more egregious provisions in the budget is limiting payment for dual eligible patients. So in 2016, New York State reduced the amount of payment for duals. This would go further and reduce compensation by limiting the Medicaid payment so it wouldn't exceed the standard Medicaid fee. As it stands right now, basically Medicaid pays for the whole Medicare deductible, which is $185. This will be brought down to only paying the Medicaid fee-for-service rate. Right now, the Medicaid fee-for-service rate in New York State is about 55% of Medicare. That's the fourth lowest in the country. We're still waiting on the details of this and the more information on the potential financial impact. But we believe that it could be about $80 per patient, which is a very significant hit. We don't really understand why the state is working to reduce access to care for the sickest and most vulnerable patients, because these patients are Medicaid patients. They could not be balance billed, and so physicians will be on the hook. The budget also contains provisions to expand workers' comp. It would allow PAs, NPs, social workers, acupuncturists, and licensed social workers to treat injured workers under workers' comp. We do have concerns. We don't maybe like the way that it describes coordination of care, and we also have concerns with determination of correlation. So that's it for the budget update. We just want to encourage you to get involved as much as possible. The government affairs team is always here fighting for you, roaming the halls of the Capitol, the LOB, meeting with staff, legislators, executive staff. But it's also really important for you to connect with the decision makers. You as a physician, your voice is very well respected, and you could best elucidate your concerns in our agenda. If you could recruit your colleagues to join in and do anything that you can, that would be great. If you would like to join the PAC and the PAL, the links are right there. We welcome you. And just keep in mind Physician Advocacy Day. That's our annual tradition where physicians come up and push MSSNY's agenda. This year it's on March 6th. It'll be at the Egg in Albany. If you want to get more information, you can go to www.mssny.org/lobbyday. We'd like to see you out in as much full force as possible. So please join us. We look forward to seeing you, and thank you once again for joining.